and welcome to today's webinar hosted by International Socialists, Voices from the Frontline Workers' Struggle During COVID. Before we continue, I would like to acknowledge that as settlers, where our occupation lands that are on indigenous territories of Turtle Island, we also acknowledge that we support all the struggles for indigenous sovereignty in whatever forms they take by the hundreds of First Nations and Inuit communities that have resided here for many thousands of years, and by Métis communities that have developed in the last hundreds of years. We're gonna have 3 speakers, and after they finish, we're gonna have space for questions from the floor, and we will also close with some remarks from the speakers again at the end. So our first speaker is Connie Ndlovu, President of CUPE 77, and works at Sprinter Senior Services. Is one of the agencies in a composite local that represents over 600 personal support workers, or PSWs. Connie is a PSW herself and has been involved for close to 20 years in organizing workers in home care. PSWs are amongst the lowest paid. They struggle for minimal hours and they have a high rate of injury. Next, we're gonna have Peter Votsch, who is the Vice President of TNG Unit CUPE Local 7797, and is member of the International Socialists. And last but not least, Sandi Mansfield, Niagara region, bus driver and member of the International Socialists as well. Without further ado, I'm going to open up the floor to Connie.
Okay, thank you, Sister Janet, and good afternoon, everybody. I'm pleased to be here to speak on the issues that we face at our workplace during this pandemic. You know, how this pandemic has actually amplified, our workplace issues in our local and our 5 different workplaces right now. It's been mentioned that we're a composite local. Can you hear me?
Yes.
Okay, thank you. Yeah. So COVID has added more issues that workers have to struggle with now. As we all know, COVID has not only exposed serious issues facing us frontline workers, especially the risk of getting the virus, but at our workplaces, there's more struggles now in addition to COVID risks. Health and safety regulations that have come forward because of COVID has actually created a lot of issues at our workplaces. For example, the regulations around distancing. We found that, our spaces are very small, to allow for that distancing. So there's overcrowding in certain offices and certain rooms, which is not what is required. And that, is creating some serious health concerns. But also issues that have come to my attention most of the time is the interruption of our break time schedules, because in the lunchrooms, people have to be 1 or 2, depending on the size of the lunchroom, to allow for that 6 meters apart. So some lunchrooms are only, can be 1 person. So for people to get to those lunchrooms, those who are working in the offices or supportive housing, congregate settings is really creating a lot of problems. But also, eventually, members get into conflict to say, well, I actually thought I was going to be there at 3 o'clock. Now there's somebody there. So there's those issues where people now are actually going without, having their breaks because of the space. Also, the shortages of PPEs continues, especially in home care. People continue to have, less masks to use. They have to reuse their masks, which also poses risks because, some of our clients in the community are not well themselves, but also we don't know really, they live alone. We don't know who visited them during the time we were not there. So we have to change our mask before we go to the next clients. But sometimes that's not the case. You have to use your mask, maybe we've got 2 throughout the day. The face shields also are in short supply, even if, it's not being covered so much in the media. There is serious shortage of face shields in home care. I say that because sometimes we don't have those when we're in home care. We might have some in the supportive housing or congregate settings, but we have, our workforce working in different areas of our communities. But also, we have also seen, maybe a rise of, which I think is very unfair, of discipline meetings for members who are not wearing their PPEs. This is an issue that has come up as well, but we know that people are struggling. This is a new pandemic. Nobody has lived through it before. It's very hard to give someone a shower in a small bathroom and you are wearing your shield and you are wearing your mask. At some point, everything is gonna get foggy. It's either you have to remove your goggles or you have to remove your mask just to, breathe. But we've gotten into problems where, there's been reports back to supervisors that, our members were not wearing masks when they, visited during their home visits or during the time they are working. So there's been explanation as to say, I just removed my mask just for, just to breathe because it was too hot giving a shower, or my shield was foggy. You're cooking in the kitchen. There's just so many things that are happening. But unfortunately, the employer, once again, they're, responding to these reports with an iron fist where they want to discipline our members. At times, people have been suspended. Of course, these are regulations that we all have to follow, but there's also challenges when you're cooking, you're wearing a shield, or you're giving a shower. It's gonna get foggy. At some point, you won't be able to breathe, which also, that's a health and safety concern for us. But also, workload is really an issue that we're struggling with now more than ever. As we know, there's serious shortage of, PSWs, both in home care and other healthcare areas. Some other PSWs left home care, they went to long-term care, due to the reasons we all know, better wages, decent work. So they chose to work for one employer as per the regulations. And that created a lot of, workload in our areas where we are. And this is actually, resulted in total stress and exhaustion for many workers trying to, to provide care. People are short-staffed, but it's even worse in supportive housing or congregate settings where, sometimes, clients go on isolation because they've been exposed or they had a fall, they ended up in hospital. So when they come back, they have to be isolated for 2 weeks, which means it's only one worker who has to be going there. So it's a lot of work to do with the donning up and donning down. But at the same time, it's not one-to-one. You still have other clients to take care of. So it's really created a lot of, workload issues, burnout, as well as, loss of injuries. We have at Sprint alone, I think we've got about 6 workers who are on WSIB. And I think the whole local, we could be having maybe about 20-something to 30-something PSWs who are on WSIB because of injuries. Trying to rush and, trying to navigate all these, new rules around COVID and PPEs. But also we've seen, what's on the rise also in our workplaces, what we're gonna call maybe unfair labor practices. Exploitation is on the rise as well during this time. For example, an issue has come up in other supportive housing and other bargaining units in our local, where the employer is telling us that the government is asking congregate settings or supportive housing to reserve one spot, which is gonna be called a long-term care spot. It's already happening in other areas. And what I mean by this is that because we know there's critical shortages of beds in long-term care, nursing homes or hospitals. So we might have clients during this time who can deteriorate to a point where they have to leave the supportive housing or the congregate setting and go to a long-term care or nursing home. But now the waiting list is above and there's no way they can go because of the COVID. So the employer is telling us that the government is asking them to at least have one room designated to a person who has declined to that level, where now they require long-term care level of care or nursing home. But the problem is that that can be done. But we all know that people work in nursing homes, PSWs work in nursing homes, hospitals, or long-term care. They provide a certain skill of care towards the clients. And that also comes with a higher compensation. Their wages are higher than what people get in home care. So if you now want home care to provide long-term care in our settings, that is unfair if it doesn't come with wages and all the resources that and equipment that is needed to provide for clients like that. So I really want us to really pay attention to this, because the government can try and push it very quickly. Like I'm saying, it's happening in other places. For example, at Sprint, we have a congregate setting, Pine Villa, where they're having Hoyer lifts, but it's really nursing home care. But these PSWs are still making $17 an hour, yet providing care that should be actually provided at a long-term care facility. And the employer is telling us that this is what the government is asking them to do. The government is asking them to do that to the workers without any dollars on the table. So that's a really serious crisis that we have. It's an issue that is coming in home care, and it's exploitation at its best. And we really need to come together as the labor movement and fight against this. It's not good. So also we've seen a rise in lack of communication and transparency from the employer, especially around during this time of the COVID. Our members are left not knowing what's happening within the agency, such as new policies and all those kind of things. But the employer wants to say it's because of the pandemic. But we know that there have to be ways of communicating with all staff, including those who are working from home. Sometimes we don't know about layoffs, and the employer wants to just say, well, they are also following the news that tomorrow the schools are closed, so the people are working in daycare, tomorrow they don't have a job. So we have a collective agreement in place, and I know times are hard, but we also have members that you are responsible for, who are frontline workers. I need to know that I have a job tomorrow, not to get a phone call that don't come to work tomorrow because the schools are closed. I mean, there has to be ways of working with the frontline workers when such issues happen. But it's actually on the rise that the employer seems they can get away with, violating the workers' rights at the workplace during this time of the COVID, and we have to push back. There's also, fresh struggles around, discrimination when workers call in sick. Some workers are being compelled to go for a COVID test when they called in sick and reported that they have migraine, which goes away with, maybe rest and taking, regular medication. But other workers are not being penalized for that. So you find that some workers who are being forced to take a COVID test just because they called in, maybe they had a toothache or a backache. In most cases, they have to use their sick time to cover those requirements from the employer. And it's not happening to other members. So it's something that we're dealing with in the local, and it's something that we're looking at very closely, because we still believe that transparency has to be there, and workers have to be treated the same by the employer, and the employer should not try and get away with exploiting workers or discriminating workers just because there is COVID. It's enough to deal with COVID as a PSW in the community on low wages and just being the lowest paid people in our society, than to let the employer also create rules that are going to make it worse. Also, the issue of vaccines has also created some friction at our bargaining units, workplaces. Some, as we know, it's not mandatory to have a vaccine, But we've also had managers using their power to try and pry into people's private lives as to say, why are they not getting the vaccine? Is it because of their culture? Is it because of their religion? Is it because of whatever? But what we know is because it's their right. And whatever is going on is their right to refuse the vaccine, but also they have rights to privacy. So it's not up to the employer to know why people are not taking their vaccine. I think it's enough right now. It's not mandatory. But at the same time, there's been talks, especially at other workplaces where, the employer is thinking of, they might create policies that are going to compel members to be vaccinated regardless, maybe, or stay home until, this pandemic is over. So I think we're going to deal with that when that happens. But I can assure you that it's going to really create serious problems for racialized workers on the front line. It's really taking away the rights that we really don't have as racialized workers so much. But this is going to really be the final straw, the final nail, because how are you going to refuse to get this vaccine if you want to remain employed? It's a conflict of your rights as a person. It's a serious violation, but it's going to get to that, our rights as racialized workers won't matter in a developed country that protects human rights like Canada. We will be faced with no choice to stay home or to go to work and get this vaccine. So workers, some of them, they've come to me, they are really concerned about that, and I'm concerned as well. I think it's a human rights issue, but how far are we going to push back to put food on the table or to respect our rights? It's a very serious choice that, most of our members will not have. I don't know how we're gonna have to deal with that as a labor movement, but also as a society, as human beings. But also the other issues that we're facing at our workplaces is really around, people who are working from home. We've seen extra supervision from the employer to a point of really abusing their powers over workers who have chosen to work from home, not because, it's prestige or what, but because of healthy reasons. Some people, their medical doctors have told them, not to go outside, but also their work can be done from home. We've seen the employer amplify supervision on those people working from home to a point of really harassment. We've written grievances, we've filed grievances on some of the issues. And it's an issue that, is ongoing in different bargaining units where people are called 3-4 times a day by a supervisor. But that doesn't happen when people are working from the offices. They hardly see their supervisors. But it's just that because someone is at home, you want to really police them that way, and it's just not fair. It's an issue that we're fighting against in our local. But also we're seeing the employer, also trying to, we have a serious issue coming up also in one of the bargaining units where the employer is trying to introduce cell phones to give to PSWs who work in the community. And these cell phones are going to have a GPS. The employer has already told us. So they're going to be monitoring workers where they are, at what time they get to clients and stuff like that. It's not that workers don't want to go to work or be paid for the work they didn't do. They've been using, timesheets where the clients, sign the timesheet to show that Connie was there for work. But now the employer, somehow during this pandemic, when workers have stayed on the front line since the first wave of the pandemic, going in, in buses and everything, risking catching the virus, going to see our most desperate clients, all of a sudden the employer might think that people are not going there. We don't know. So they want to introduce this cell phone with a GPS. The unfortunate part is that many PSWs in this bargaining unit don't want this cell phone. However, most of our racialized members, as I say, that sometimes we make policies that are difficult for people to choose to remain at work or to refuse a cell phone. So we don't know what will be the aftermath of this, but the union is fighting back. We have meetings coming up with the employer and the PSWs in that bargaining unit to talk about this. But just to show you that these are the issues that, you know, on top of dealing with the stress of the pandemic and ducking the bullet every day, we still have the employer who think they can also introduce other punitive policies. Nobody needs a GPS. People go to work and come back and go home. That's what people are doing right now. They are rushing. And these people working in the community, PSWs, our sisters and brothers, don't even have lunch break. Or if they did, there's no spaces to sit down and have your lunch and remove your mask. So they are rushing to get the work done and go home. And clients who live in isolation, who believe in the work that we provide to them, are very grateful. They want us to work and go home as quickly as possible. But the employer wants to monitor how many hours I spent there, which means if the client says, you know, Connie, you can leave, in 50 minutes now, you don't have to stay until 1 o'clock. I can't leave because the GPS is gonna say I left early, right? And the employer is telling us, well, but that's not a problem, Connie, we're still gonna pay you for an hour. But we all know sitting here that the employer is trying to come up with a way of scheduling that is gonna exploit our members even further. If a client wants you to stay for half an hour because all they wanted was a cup of tea, and now they don't want anything, so you can get going with your day, the employer is gonna say, Connie, you're only there for 30 minutes, so we're gonna have to pay you for 30 minutes. So we have to push back on that. There's nothing wrong with the employer giving people, you know, some devices to use to make their work easy, but giving devices that are going to track people's whereabouts during work is invasion of privacy, comrades. And I think, we have to speak about these things. We all have to know, and we have to push back. Thank you very much.
Thank you very much, Connie. And Sandi, we're going to go to you next, if that is okay. And you have about 10, 15 minutes, and I'll give you 2 minutes to wrap up.
Okay, so did I get my volume on the phone here? Can everybody hear me?
Yes, it's perfect.
Okay, I'm going to start off with, so I am actually a member of ATU, which is Amalgamated Transit Union, Local 1582 in Niagara Falls. And I just wanted to start off with, at the beginning of the pandemic, ATU International, mostly in the US, saw, in that first year, we saw over 150 deaths of members from the pandemic. Just recently, in the last month, we had a member of the GTA die of COVID. The vice president in Brampton, and I can't remember the local number right now. So that's sort of really hit home with a lot of us because it's a lot closer than the US. So it's brought up a whole new set of stressors for many people. With transit, there's been a lot of challenges. As a previous speaker, Connie mentioned, the trying to skirt around labor laws and exploit workers has been very prevalent. The ramp up of discipline over things like missing time. Like first they tell us, oh, you can take time off for not fit for duty. We're driving $1.5 million vehicles around, and you don't want people driving a bus who are tired or fatigued. But then if that's supposed to be not fit for duty, so they give you time off with no pay, except what they've been doing is putting it down as sick time. And then now you're getting a letter saying, oh, you've used your sick time up. You have to have a doctor's note to come back to work. So now, like, try and get into a doctor and get a doctor's note. So now you're off for more. So it's just completely ridiculous. Some of the other things that have happened with this latest shutdown, Niagara Falls Transit is not a commission. It's part of the city of Niagara Falls. And when they shut down City Hall, I don't know what they did. We don't even know what they did to their phone systems, but we have casual operators that have to call in every day to find out what they're doing the next day, and there's no way to get through. So management has been giving us a backline phone number, which they didn't want us to have, which we have now. The one thing that came up, we were in the midst of contract negotiations in the last year. We did ratify a contract. It gave us 8 new permanent 40-hour positions and 6 new 30-hour permanent positions. They're called reduced guarantee. So we still have casual operators, but we were able to gain some more full-time employment. We also were able to get in the contract that any casual operator who works 40 hours a week for a year will automatically be given a permanent position at 40 hours a week. There's ways they can squeeze you out of that too, but we'll see what happens with that. We have had no union meetings. We've had a couple of Zoom meetings, but ATU International will not allow us to have meetings where we vote on anything. In the last year, we've had 1 meeting that was in person because we could. We had the ratification vote was the employer actually gave us space to have that vote. We also had to have a new health and safety rep. And the employer did give us space to hold that vote. The PPE. So from the get, initially we were told not to wear masks. Then they put a bio barrier in so that people could front load and they could start charging fares again. Then at the beginning of this year, they finally told us that we had to wear a mask anytime we were in the building, on and off the bus, when we weren't behind the bio barrier, in the various lunchrooms. And they gave us 2 masks that don't really fit most people. They were kind of lenient with us providing our own reusable masks. Until somebody actually wore one that was very distasteful and a customer complained. So now we have to have a solid colored mask. I'm going in today because there's not much management around. This is not a solid color. It's not acceptable. Too bad. I don't care. So the riders group, well, so we have down in the Niagara region, we have St. Catharines, Welland, and Niagara Falls are all amalgamated transit union. There are some regional buses that run between Welland, St. Catharines, and Niagara Falls that are operated by those 3 agencies, but they're paid for by the Niagara region. Fort Erie is a private contracting company who runs their transit service. Their contract's up the end of this year. Those workers do not know if they have a job or not because the city of Fort Erie is considering doing what's called on demand. Basically, you call a taxi, you pay your $3 and you get a fare wherever you're going. Not necessarily the best way for public transit. The region has introduced Niagara Regional On Demand Transit. That's where there's an app on the phone and you book a ride, which could be, which is usually like a cab company or something that does that right now. We're fighting hard to actually have real routes to Beamsville, Grimsby, Port Colborne, all the Smithville, all the outlying areas. The other thing that's happening, and this is where the 3 locals of Amalgamated Transit Union, the executives are working together. By 2022 September, the regional transit or transit in the Niagara region will be regionally administered. We don't know what that means. We don't know who's going to do what, whether we have jobs, all of that stuff. We've got all these stressors on here on top of dealing with a pandemic. The lack of communications has been really apparent. Things happening right now. They've got a problem in service. So that's where they fill up, put fuel, rad fluid, washer fluid, DEF fuel, whatever they got to put in the buses, and wash the exterior of them. All of a sudden, there's nobody in service. They're all off sick. And some of us operators have been trained in service, so they're asking us to do that, and they're willing to pay us overtime, and they're willing to pull us off our run, put a junior driver in our run to cover the shift, so that we can go in and work in the garage. We wonder why they have such a problem. Is there a problem that there's been a COVID outbreak? Who knows? We're not being told this information. The other thing that's going on is with the new manager in the back shop, with the mechanics and the service people, they are looking at going to a 24-hour garage instead of right now, it's about 20 hours a day. So who knows, maybe it's a sick end too. All of this is leading to tension. The workers are fighting amongst themselves, which isn't good for us to try and get, demands from the employer when they can see that people are just arguing with each other, so they can try anything they want. When I was talking about the PPE, so mechanics or technicians in the back shop have to wear masks when they're not working by themselves. They ran out of the blue masks they gave all the other city employees, so they issued white masks to the mechanics. I don't know how many of you have ever been around bus breaks and stuff like that, but those masks will be black within an hour. Connie had mentioned about breaks, because of how our breaks, like it's not easy for them. I bring my bus in, I go for my break, somebody does my run, I have 30 minutes. We have one lunchroom that has multiple buses coming in there. We're only allowed so many people in the lunchroom, yet there's more than that amount of people scheduled for breaks. So yeah, we're standing outside. We're not able to have a real break. Let me see, what else did I have? Okay, so in the first wave, what they did when they went to the first lockdown, they changed, Niagara Falls changed to Sunday service, which means there's whole areas of the city who have no transit. They tried that for 1 week in January. They had so many people call in. Well, of course, us bus operators sort of told people to do that. They had so many people call in and complain, but it's things like all your retail workers, Walmart's big store here, all those people were left with no way to get home from work. I was talking to one woman who's a PSW. She has and on Sundays it's a problem for her the rest of the week because the bus actually runs there, but runs within 20 minutes of where she is. But on Sundays, she goes in for a 4-hour shift. She gets paid $60, and it's costing her $40 in taxi fees to go to work. So it's not even worth going to work. The other thing with our bus service going to Sunday service, a lot of our service ends at 8:30, 8 o'clock. So we've got people who can't get home from work, the retail workers, the people who work in the tourist industry, and I'm not even going to go into how they shouldn't even be open, but and PSWs. We have PSWs and nurses who take our bus, so they're going out to deal with the clients that they have, and now they're stuck not being able to get home. So if they don't go to that client, they don't get the work, they don't get what they need, the healthcare they need. But so it's completely ridiculous, the whole thing. The other thing that's been very, very, very frustrating for us as transit workers is the lack of mention of public transit in the provincial budget, the lack of mention of transit and how that's going to affect it when they announce the lockdown and stuff. But the other thing is transit operators, transit personnel, transit workers in the list of where the vaccine is, we are about third from the bottom of the list. And this is just like, we are transporting essential. They keep saying we're essential. Well, we're not, if we're not, we're not being treated that way. And I mean, they have said that if we can, the memo that came out last week, and this is why this timing thing, all of a sudden, all these people are off in the back shop and they post a bulletin about encouraging us to get the vaccine as soon as possible. You know, you got to read between the lines. There's something going on here we're not being told. So what they did say was that if we get the vaccine, we will, they will accommodate us for whatever time, like just get an appointment and we'll accommodate you. I'm sure the accommodation is going to be an unpaid time off, and I will be challenging that because actually, believe it or not, my doctor's office called and offered me one next Tuesday and I took it. I said, I'm taking it. I've talked to them. So they can't organize it till the day of, which is like crazy. Like pre-planning is, it drives me nuts if they don't pre-plan stuff in this place. But, you know, so yeah, I'm getting my vaccine, but I have no idea when I'm being relieved so I can go and do that. I have to drive to the doctor's office from my workplace. Like it's just adding stress that's completely ridiculous and uncalled for. I think, and the only other thing I wanted to say is that my mother-in-law was in a long-term care facility and recently died. But the thing that's become really, really, really apparent is that the funding and the staffing for long-term care facilities is not what it needs to be. For-profit non-care places are worse. And we need to, like I was saying about the transit stuff, our union nationally, provincially, locally, we have been fighting and fighting and fighting for our workers, and they're not listening to us. But like we proved recently in Niagara Falls, when the other workers call and say, we need transit service, they listen. So I'm thinking the thing that we have to do is, I'm a transit worker, but I need to be fighting for those PSWs and those nurses and those people in home care and long-term care, that they get paid decent money and then they get the PPE that they need so that they can provide the service they need to. In the same respect, those PSWs and healthcare workers need to call and demand better public transit.
Yeah.
Teachers, like it goes like, I need you guys to fight for transit. I'll fight for everything else. Thank you.
Thank you, Sandy. We're gonna have Peter, and after that, I will welcome your questions, them in the chat or raise your virtual hand. Peter, go ahead.
Hello, comrades. Peter Votsch. Just wanted to, I'm actually the Vice President of TNG East, not TNG. That's an old moniker. We're growing and welcoming in people like Sister Helen Armstrong, who's with us today in Local 2289 of CUPE. And I'm retiring soon, so frontline is not much longer. But I just wanted to echo some of the issues that have been raised by comrades so far. Connie said it very clearly that the employer seems to think that they don't have a collective agreement in place that they need to observe, and various excuses around COVID and things are changing so fast, etc. We've been busy trying to sign more agreements with them and put things in writing, but again and again, that is a theme that comes up. Oh, it was an emergency, etc. And this is a context. I work in social services with the homeless, and I have at this job for 22 years. I worked in shelters, etc. And our workload is way up. We're short-staffed. People are off sick. You know, as Sandy mentioned, if they're off, they're self-isolating, etc. The level of stress is very high, right? And this is something that we've had to deal with. And on top of that, the violations that we see. So I just wanted to segue a little bit to health and safety and how important that has become. Because we've seen struggles in the workplace around that. Most famously, Sandi was at a walkout with the TTC workers at Kipling, one of the yards near where I stay in Toronto. And that was a superb example of people fighting back in many ways, as transit workers have, and those of us in multi-service agencies. Connie talked about PSWs and people who work in social services. And health and safety is a really important organizing tool for us nowadays, because what we can do is we have the right to refuse unsafe work, and we don't have to have a concrete reason. We have to feel unsafe. And that means going into people's units. That means dealing with various clients in different situations, going into drop-ins for us, shelters, etc. Postal workers, yes, I see your note there, Cam. That's another one. So there's been some fantastic organizing around that. It's kind of a segue away from what we can't do, which is picket, which is different things that we can't congregate. So in one case, I know that for me, I've been involved in CUPE for 25, 30 years, so I know my rights, and I've sort of done the work refusal. And when you do the work refusal, you say, I won't go to the employer, you can bring other people with you, and that's the gold standard for trade unionists and for socialists, is that we want to carry people with us, and even if we have to do it via Zoom or whatever, we're doing it on the phone, we're carrying people with us and saying we're not going to do that. This whole department is saying no. And keeping in mind on that issue that it is the employer's onus. And that is what we won after the terrible tragedy at Hogs Hollow, which was the brothers building a subway in the subway in Toronto, the TTC, who were killed, and I would say murdered, by the employer, the lack of health and safety in 1960. And after that big push by the labor movement, enacted legislation that puts the onus on the employer to provide a healthy and safe workplace. And that includes masks. Right, and that was raised. That's been raised also in our local, Sandi, and it's such a pleasure to hear from other workers here. Yeah, masks that fit, right? Equipment that works and that fits. This is something we need. It's not just PPE; it's the kind that we need. That works for us and that keeps us safe. That isn't halfway up or down our face or is inadequate. And the other issue just around PPE, it's not just PPE that we need. We need the employer to begin taking safeguards like screens, like workstations that are 6 feet apart, that keep us safe from either our clientele or coworkers or the public, etc. It's not just up to us. The onus, like I said, it's the onus of the employer to provide a safe place of work. It's not up to us to provide that safe place or to wear your PPEs. They've got to spend the money on making sure that we have a margin of safety, right? Whether it is anywhere. My workplace is the same thing. We want plexiglass in the right place. We want control over where it goes and what it covers. And that's crucially important. Back to work push. Always, and everybody, I'm segueing into working from home. The employer is constantly wanting to pull people back to work, and that's just a mess, right? As you can imagine, this has been happening with our workplace constantly. We're going back into drop-ins for me, and shelters and crowded places where there are outbreaks. No, we've said no. We've done the work refusal. We've said we're going to do another work refusal. We're not doing it. We're not going in, especially those of us who are more vulnerable, who are older, et cetera. We've said, you're not sending us back in. People have illnesses, et cetera. You have to look at that. And you have to look at what it means for us to go back safely into other workplaces and other places where people congregate settings. What are those employers doing to safeguard us? So very important issues for us. working from home. I'm sort of segueing into that. So people have been working from home. And Connie's right, we find there's been a rise in harassment, that this is kind of interesting, of people working. So workers working from home. I want to say it's not middle class people, because they work from home too. You hear all of it in the CBC. I'm a little tired of it. There are many workers who are working from home, and they are being policed, and there's a rise in policing of those workers. The other thing about that is that managers work from home. Ha ha ha. And I'm sorry I'm being so sarcastic and cynical. I'm just, I've seen this, that Connie touched on it. You call to make sure somebody else is working from home and you're working from home. You don't pay attention to people on the front lines. And I don't work from home personally. I've said, no, my home is my kingdom. I will not do that. Find me work here. But anyway, that's fascinating in and of itself. But it's really important for us as a local and as locals to make sure that we don't fight amongst each other. How am I doing, Janet? 2 minutes? All right, I'm going to finish this off as quickly as I can. Vaccination, pressure to be vaccinated. We've talked about this in our branch meeting. This is really, really going to be an important issue, because employers are going to be able to look at people. They're asking for people's vaccination records. So it's going to come down the pipe. That people are not going to get promotions. They're not going to be able to move on to other jobs because they were not vaccinated. There's going to be a discrimination here. And I know unions and progressives are all for people getting vaccinated, wearing their PPE, etc. But we will also defend people and their right to be vaccine hesitant and even not to get the vaccine. There's many reasons, not just the people who march at Yonge and Dundas. There's a lot more than that. What do I want to finish off? I just wanted to talk maybe about some of the limitations that we have in the pandemic and the possibilities. So the limitations are that we can't organize in the same way. Like I said, health and safety, but we can't bring people to grievances. Many of the things that socialists rely on is kind of organizing is much more difficult. Around bargaining, we don't know how that is, because remember that when we talk about good language and good collective agreements, we have to organize to get that. Unless we're organized on the ground, we're not going to get what we want when we step up to the table, that great bargaining table that they tell us always to go to. We have to do the organizing, and we have to have control when we go there. I'm almost finished here, Janet. However, there's new opportunities for us to use the existing laws that we have, and that's really important for us as revolutionary socialists, is to understand where those laws come from. Often we think of laws that limit us, but actually these many laws in the workplace, they're for us to defend, otherwise we're going to lose them. And it's so important in this time that we stand up and refuse to do unsafe work and organize workers around that, and collectively say, like in schools, like at bus depots, we're not going in unless you, the employer, ensure our safety. And finally, I just want to say that we've welcomed in, looks like a new unit into our local St. Felix. They're shelters. And what was happening with them is they were being fired by text. Isn't that interesting? The employer sitting at home, yeah, again, and I really don't like this. The employer that finds themselves at the front of the vaccination lines, by the way, they're not front line. Let's be clear who's front line. So anyway, these are things that bother me, but I think they're a reflection of the class society that we live in, that these folks managed to reprimand us very easily, get vaccinated very easily, and email discipline people virtually also very easily. And it's the onus is on us to organize to fight back. Thank you, comrades.
Thank you, Peter. Thank you, Sandi. Thank you, Connie. We're gonna have about 20 minutes or so of conversation. Please feel free to raise your hand or put it in the chat. I'm gonna be taking names. I cannot see the virtual hand. Sometimes people raise their hand as well that way, but I wanted to thank the three speakers for really sharing with us the importance of union work and education on what your rights are. The floor is open. Carolyn?
Yes, thanks very much. And I know Sandi had to go on to her shift, but I just wanted to say I thought all three speakers were just excellent. And I think there's not a lot of opportunities, frankly, to hear, as Peter said, the real frontline worker talking about his, her, them, their situations that they are dealing with on a day-to-day basis. And there's this sort of phenomenon that we hear from the lips of Trudeau, Ford, and everyone else that we are all in this together. And I think it's really true. It's really not true. And I think that the truth comes out when you hear people speak and what they're up against. And reading this morning in the paper, when you look at the areas where people are having the option even to get vaccine in the northwest quarter of the city, where they, across the GTA, they've been allowing pharmacies, drugstores to be able to give. Practically none are being located in these areas. I mean, there's a bit of a change up because of the pressure, but I think when, when Connie and Sandi and Peter have all spoken and, talking about PSW situation or a transit driver or Peter working with the homeless, people are going into work every day. I mean, I'm a healthcare worker. We've all been working through the whole pandemic since last March, and we go into work every day. And having had to fight and struggle for everything we've got. There weren't enough PPE at the beginning. The social distancing had to be fought for, the plexiglass dividers, all of these things. And so many of our workplaces, they're all different, but all of them we've had to fight for. And the need for unions is so clear. I mean, not that unions are perfect, and we know we have to struggle a lot, but nonetheless, you just look at the long-term care situation and the profit, non-for-profit, and where there are unions, at least we have a fighting chance, if I may put it that way. But I think that there is just so many lessons to be learned from ordinary working class people about how, frankly, we're the ones who have kept society alive, kept society going, kept things services going, and we did not retreat. I mean, Connie, the PSWs, we did not retreat. We did everything we could to provide the services, because that's why so many of us are in the service industry, I suppose. But it's reprehensible, and the fight for paid sick days, as was mentioned, the fight for health and safety, and when those TTC workers. They did the walkout in the West End of Toronto, and they did have the support of their union to do that. I mean, but they were forced in the end to go back to work. And from what I understand, maybe it's changed now, but you have situations where people are being forced to go back to work, and the ministry is being very, very, very lax in pushing any of these needed changes. And because I'm a member of the United Steelworkers, in my own local, we have a lot of what we call essential workplaces, like mattress factories. These are essential. Why are these essential? And we had a situation in a workplace, not in my local, but in 5338 of the United Steelworkers, 100+ workers, 30 of them came down with COVID, one died. I mean, this is absurd. A 53-year-old man died, leaving a family, children, etc., behind him. And it's just reprehensible. And when Sandi was talking about the deaths of 150+ transit workers, and I guess this is across North America, it's suffering. People are suffering, and women, racialized women. I mean, we are the vulnerable people, the working class that keeps society running, who are paying the price, paying the huge price. And I think, as Peter said, the role of socialists and organized socialists in this fight is so critical, because we're able to bring forums like this and have the actual workers who are bearing the brunt speak about their realities and the things that we work in, the groups we work in, like the Good Jobs for All Coalition, et cetera, that, did forums, with activists and trade unions, with the ATU here in Toronto, activists in the Jane Finch community, the Black Creek Community Health Center, and what they're up against, and why it is so clear as, and I'm not saying we're coming out of it, but hopefully there's some light at the end of the tunnel. We have to learn these lessons, and we have to see that, it's through our efforts that there's going to be change. And I think so many people have learned this lesson through this, and we just have to do all we can to bring a message that the world can be better. Working people have the right to run our societies, run our workplaces, and we're going to get that through, a long-term struggle, obviously, for social society. But I just find it very inspiring to hear speakers like yourselves, and thank you for being here today with us.
Thank you very much, Carolyn. I have Michelle and then Pam.
Thanks, Janet, and thanks to the speakers. This has been really a great panel, and it's almost overwhelming how much information you've been able to lay out for us about the current conditions and about what we need to do in response to what's, just another wave of assault on working class people and on racialized people, racialized workers in particular. And there's a couple things that I wanted to just put out there and see if Connie and Peter would come back on, or other participants. The first one is coming back on the vaccine refusal. I saw an article last week about in Northern Ontario, there's hundreds of healthcare workers are refusing the vaccine. And it's something like 10 or 20% so far. And so I think it is a live issue. And there are lots of reasons, as people have said, why people might not be willing to take a vaccine. And how do we tackle this as socialists? Because there are a lot of critical issues around a racist healthcare system and the legacy of that in Canada and in other countries, and how unions as organizations that need to fight against racism are going to include that in the discussion. So I do think it's an important question. I don't have a particular a particular idea of how one goes about this, but I think the question of people's control over the vaccine is critical, and it feeds into a global question about that's been raised by a number of unions and social justice organizations, anti-racist organizations, for a people's vaccine. That we need, it poses the question of, can capitalism deliver a proper solution to this pandemic in conditions where the big companies like Pfizer, Moderna, and all of that they're for profit, and the whole question of patent legislation and how this is all unfolding. And so I guess one question I might have for comrades who are in unions is, has the question of a people's vaccine and how unions around the world, in particular in countries like Canada, where Canada has been one of the key obstructions to overriding the patent legislation and allowing countries that currently don't have access to the vaccine to be able to manufacture their own without this patent prison. The third thing was about the question of defending the right to strike and how vital that is. And just to mention that two things. One, Quebec public sector workers are gearing up for job actions. There have been strike votes taking place. And so that's something to keep an eye out, because the pandemic has really put the brakes on workplace action. And we're all feeling, not just workplace action as it's typically known as strikes, but any kind of protest. The other thing is internationally, hospital workers in Greece have been taking militant action against reprisals against union activists who have been denouncing the lack of PPE, who have been denouncing the way that management's organization of the workplace is spreading the pandemic. And also a healthcare worker in the UK who organized a rally rejecting a 1% wage increase for healthcare workers. She's a nurse. She was found 10,000 pounds for organizing a rally. So there's these things going on, but these fightbacks are also building out of that. And the last thing is just, did people know that in Brampton, you know, they closed the Amazon warehouse? Over 900 workers in that Amazon facility had been tested positive for COVID. And the Ontario government offered 5,000 doses of the vaccine to Amazon, like to have this to the local health authority for Amazon workers. And the local health authority rightly said, like, there are a lot of frontline workers who are not getting this vaccine, and they refused it. But just this is the kind of stuff that's going on all the time about the unjust way in which the vaccine is being distributed. Oops. Okay, I'll stop there.
Thank you. I have Pam next, and please put your name on the chat or raise your hand.
Yeah, thanks, Connie, Sandi, Peter. That was just fantastic. And I was just going to add to the list that Michelle started on who is fighting back in this, because one of the places where there's been a phenomenal level of activity, but we don't hear very much about it, is in the US, where they have a very low level of unionization, but there have literally been thousands of wildcat strikes by, you know, mostly small groups of workers trying to fight back against the conditions that they find themselves in under COVID. And it's really an inspiration. I think it also speaks to what we're seeing in the situation where, as Carolyn mentioned, workers are having to stand up. Then when they face the government, the possibility of having the regulations that are supposed to be in place, the health and safety things that Peter was talking about, then they aren't taken care of. I think that we're finding that situation that people are actually needing to figure out how to ramp that activity up. I do think that's one of the things we have to think about. And it seems to me like it's either going to fall on the shoulders of individual workers, or we'll have something like a campaign. So Michelle talked about the people's vaccine. How do we pull together those small actions that are happening? And for example, the postal workers in Mississauga, a worker died on their shift from COVID. Those workers did a work refusal. That actually led to a whole bunch of activity in at that plant, creation of a protocol for people to have to go through a COVID evaluation, and for there to be reports of COVID cases. There were hundreds in that plant that had never been reported. So that pushed something forward. And if that were to be put together with what's happening in the TTC, with what's happening in the bus drivers, with what's happening with the PSWs, you could see how a campaign could really be built. And it would be great if we saw the trade union leadership stepping up. But I think we can see that they're not filling that vacuum. They're not, and there are many reasons for that, but mostly because, and I think as socialists, we understand that they are they're in the situation where they're too comfortable. They're caught between the employer and the workers. They feel that's where they need to be. And so the moment when they should be stepping into more action, they're frozen or unwilling. So it will always require that we have that push from underneath. And it's so great we're having opportunities like this to talk about it, for bus drivers in Niagara to talk with PSWs in Toronto. It's a fantastic opportunity to talk with healthcare workers. So, it seems to me these are the kinds of forums that provide the small seeds for where we can go to next. And I think that this is going to be happening around work conditions. This is going to be happening around issues like racism that has actually been taken up so amazingly during COVID with Black Lives Matter, and also with issues around climate change, that we're seeing some of those things interweave together. So it is a moment of opportunities. Peter said that. But I think it will be on people like us who are talking together to be able to build those kinds of networks and coalitions. And thanks to everybody who's here and to the speakers.
Thank you very, very much for the questions and the comments. I invite you folks, we have about 10 more minutes to chat, or 8 more minutes to have any questions, please raise your hand. If you can open your video or put your name in the chat, I'll be monitoring it. Okay, Sid?
Yeah, sorry, I can't raise my hand if I'm the host of the meeting for some reason. But first of all, thank you to the speakers. This is a little bit of gold for us. We hear an awful lot about the sort of the stories of frontline workers, but it's really important for us to get concrete and get details about exactly what it is people are dealing with, for us to be able to sort of think about how we can strategize around this and understand it. And so this is going to be a bit of gold, and we'll post up, we've been recording the meeting, so we are going to actually post up the talks so people can hear it, because it is incredibly important. There is one little sort of tidbit that just came up though, and I know that this has been a discussion that we've had in our own branch meetings around the question of workers and the vaccine itself, and whether or not workers are required to take it. And there was an article in the Star, I believe it was last weekend, with talking about the question of paid sick days. And one of the things that they referenced in the discussion was that SEIU did a survey of its own members, and a significant number of their own members said that they did not want to get the vaccine. And the reason why, 65% of them, the reason why they said they didn't want to get the vaccine is because they were worried about loss of wages. They were worried about having to take time off work to be able to go and get the vaccine. And they were worried about the fact that if there was anything resembling a side effect, whether or not, I mean, I don't know the science of the side effects around this, but regardless of that, they were worried that if there were side effects, that they would not actually have the ability to make their income. And so that was the biggest reason why members in frontline workers, and this is again SEIU healthcare, when they were talking about it, weren't sure if they were getting the vaccine. It was based on the fact that there was a lack of paid sick days. And so I think, you know, there's a key campaign that needs to be sort of built around that. And I think it's fantastic that we're sort of discussing this with frontline workers, because obviously the question of paid sick days is going to be key over the next little while. And it is absolutely astounding that Doug Ford is still pushing back against this. I mean, his position is essentially don't go to work if you're sick. But if somebody is sick and doesn't have paid sick days, they're going to go to work. It's completely untenable to have that kind of a position. And so I know that, this speaks to questions around the people's vaccine, around access, around whether or not, again, as Michelle was talking about, whether or not capitalism is actually going to be able to get us out of this because of the limitations that are placed on workers under these circumstances. But I mean, obviously, Doug Ford is not getting this, but the workers themselves have talked quite openly about the fact that they do need paid sick days for them to be able to actually participate in this fully. So that's just a little tidbit that I thought I'd throw out there. But anyway, thanks very much for the discussions, comrades, and I'm really, really glad that we were able to host this.
Thank you very much. The floor is open, folks, and you're absolutely right. Just as a matter of comment, my PSW actually goes exactly through what Connie was describing. They have their GPS phone, and then they have their regular phone. And they actually, like, while they're with me at home, they keep getting calls all the time, constantly. Sometimes it's to ask them to go to work because somebody else is sick, but it is, and sometimes they don't believe them they are at home. So they actually, I have to talk to them and say, yes, this is me, and they're here. It's humiliating for the worker, and it's embarrassing that they have to be put through that. So sometimes I just tell them in a very gracious way, it's like, you have to believe the worker. And it's really frustrating that they dehumanize them and see them just as a machine that can go from house to house to house. And it's, anyway, we talk a lot about unions and the SIUE because they are members. David, you're next.
Sorry, I missed the first part of this. I had a bit of trouble figuring out how to get on here and didn't realize you have to go to your website to join in. But I'm at work right now. I'm a security guard. You can see my uniform. I'm actually a member of a union, and I won't say who they are. All my life I've been a union supporter. Very strong believer in unions. Until the last few years, I've been unionized as a security guard with 2 different unions. And I'm sad to say that they're utterly useless. they've totally let us down. They've done nothing whatsoever for us. And I am a frontline worker. We deal with the public all the time, and yet I'm actually at a site run by, that's owned by the city of Hamilton. We get nothing from the city, nothing from our employer who's contracted with the city, nothing from the union. We're just kind of left to sort of swim along here on our own. So, you know, I don't know what to tell you, but unions are not always the answer. That's the sad truth that I've come to late in life.
Thank you for the comment, David. Carolyn?
Yeah, David, it's Carolyn, and I'm assuming perhaps one of your unions is United Steelworkers, because I know that the USW is in the security sector. It may or may not be the case, but I know I'm in that union myself, though in another sector. And if you want, I'd be very happy to connect with you and connect with you with other security people who have been trying to change the dynamic in the steelworker local anyway, that is supposed to be providing support, solidarity for USW security workers. So if you want to, I can put my phone number, if you'd like, in the chat, and we can connect and see if there's anything we can do to sort of help the situation a bit.
Can you do that?
I'll be happy to. Yeah.
I used to be with the USW, but when we lost, when our company lost the contract, we went with a new company. So now it's UFCW. USW was better as these things go, but yeah, I'd love to chat with you. Please put up the information.
Yeah, will do.
Well, thank you. Connections, interaction, real life. I have a question from Charmaine, and this may be just for any of the two speakers. Last call for questions, please, or comments. The question is, can the employer force you to take the phone? And I'm assuming the employer can force the worker to take the phone. And any last question, or that might be the last question before each of the speakers will have 5 minutes to close. Connie, would you like to go?
Okay, I'll go. So I think on the question of vaccine refusal, I think we do have a problem, you know, and really the trade unions will need to step up on this. Especially, you know, the sector where I'm coming from, personal support workers in home services, racialized workers with a lot of rights, our rights being, you know, not probably respected. It's going to be a very hard war to win on our own. And I'm calling upon the labor movement to really, you know, have policies that are going to be inclusive, that are going to help the racialized workers, PSWs, have their rights respected. Because it's just like, you know, the women's rights, you know, we had, you know, issues in the past, you know, where women were forced, you know, against their own rights. So the choices that women had to make in terms of birth control and all those kind of things, right? It was a big movement. It took a lot of, you know, many years fighting for women's rights to their bodies. So there's history around vaccination that we, you know, it needs to be, you know, observed. We need to listen. Then, you know, I mean, you know, it's good. It's a health and safety issue. It's a pandemic. We're trying everything to get through this pandemic. But at the same time, you know, it's important that, you know, discussions have to be opened by this vaccine. You know, when people have got reservations, some of them, they will tell you what they've experienced through these vaccinations in the past. And those are very serious, you know, reasons that we have to consider. But we will need the labor movement to help us. You know, this is what, you know, I hear, you know, the brother just spoke now that, you know, sometimes the unions are not really, you know, helpful. It's those experiences where, you know, we need leadership now. We need it more than ever. You know, people are going to be given time to go for the vaccines, but what about those who cannot take the vaccine? How are we going to protect them? They are working class people. They belong to our labor movement. They are workers. they need the protection. So they have to lead us on this one. So it's gonna be a tough fight, but the labor movement has to fight that fight for the racialized workers and other workers who think this is a violation of human rights. And I think it is, but I don't have any answer. But I think, the labor movement should be really thinking as to what they're gonna do about, policies that are going to come in the workplace and other areas where people without vaccination would not be accepted in that society or in that community or in that class, whatever it is. This is the time the labor movement has to really think very hard what they're gonna do for us in that fight. It's a fight that has to be won by the labor movement for everybody, I think. And then on the issue of the cell phones, as Charmaine has asked this question, again, what does the labor movement do? Do we say the employer will have power over the labor movement members, or what do we do? Because if the employer is going to force these cell phones, and they've clearly told us they've got the GPS, we are no longer in those days where people need to be, surveillance, like, they are not, honest people. COVID does not mean that, personal support workers are not honest. They've been working for over 20 years, people like Charmaine and myself. We've never had to be, tracked down where we are. We've gone to work. So why all of a sudden we need to be tracked down? There's serious issues to deal with. People are losing lives on the front line. PSWs are dying. We don't have PPEs, poverty wages, lack of decent work. Those are issues we need to be tackling as an employer, as the government, but not to monitor people where they are. People are going to work for 1 hour. Where else would you go? Why don't they want to talk about the funding to give people decent work? Where is the employer getting the money to buy cell phones for over 600 PSWs with a GPS when they cannot put, the $3 pandemic pay is from the government? Then if the employer has got that kind of money somewhere else, increase our wages with that money. It's not about tracking people where they are. It's about dealing with reality. We are wearing the face of poverty every day. Don't track us. Give us something. So it's an insult, but again, we hope that the unions will stand up for the PSWs. They don't have to be tracked. There are other organizations, other workers within organizations who are using the employer phones or employer laptops, whatever it is. They are not being tracked. They are not being tracked. When I worked 2 days in the office at Sprint as a coordinator, they are not tracking me. So why do you want to track me when I'm going to the community? I'm not a thief. I'm going to work to help someone in need, who needs help. So the funding must be for the work that we do, not to track us. So I think, the unions have to fight back and ask where the employer is getting this funding and what is this funding for? It has to be for work, for our wages, for decent work, not to track us. So it's going to be a fight, Charmaine, and I hope the unions are going to have to help us on this. Thank you.
Thank you, Connie. Peter, you have 5 minutes, and then Pam is going to close.
Yeah, so many good questions there. Just to continue on what Connie said about believing workers, and it's got to that too. And we're really tired because we've heard so long that workers are lazy, et cetera, especially unionized workers. That's again implicit in this. And we fought a lot of battles around this. Believe women when they talk about sexual assault. Believe people of color when they talk about being racialized and racial incidences. Believe workers when we talk about the fact that this is our day, that we're understaffed, we're overworked, and our work is not safe. It's very important that we start there. And we had a wonderful mass meeting via Zoom. We've just come lately to this because we're quite worried about using Zoom as a forum that can exclude people who are not as savvy with the technology. However, around this issue of cell phones and tracking devices, we had a large meeting of PSWs. I was there as vice president, and the sisters and brothers there, all to a person, said no. And that was the issue, was not only The tracking was an issue of the invasion of their privacy, but also of cutting their hours. So it really is a question of that. And to my sister Charmaine, who's in our executive, what I say is primarily job description is care the client. Answering the phone is absolutely secondary. The employer can wait. So that's how I do it in my job. But back to that, I'm not tracked. And I said that to this gathering. I'm not tracked because I'm a social service worker. So it's who is being tracked. It's not just tracking, but people who are in the sweated trades, so to say, are being tracked more. And this is awful. In terms of vaccine refusal, there's a lot of issues. And Sid raised an excellent point of finding out why people are refusing, because we shouldn't make any assumptions. Racism is an important assumption that important issue in Northern Ontario, obviously, especially among Indigenous people. And we need to know that. And if that's the issue, that people don't trust the healthcare system, we have to find ways around it. And as Connie said, and Carolyn, paid sick days is crucial to that. That workers, and that this doesn't pursue workers into the future now as a mark against them. Of course, in CUPE, we were going to be we've committed ourselves to defending people and looking at the actual reasons why people don't take the vaccine. People's vaccine, well, it hasn't been raised in our local. I mean, I think we're coping with so much around the workload, et cetera. But I just want to finish on this, comrades. I got the news, as we all did, and a bit of I don't call it a shock, but it was Bessemer. Everybody knows what happens in Bessemer, 2-to-1 vote for the company or against unionizing. And it caught me and it upset me as a revolutionary socialist to see it. But, it's an opportunity also. And I was reading in these times, our defeats of today, we are learning a tremendous amount. These wonderful questions, Michelle asked about the vaccine refusal. We're learning that. How do we figure all this stuff out? And we live to fight another day in our class. And so many of our battles have been in that vein, that we take our lumps, we lose our strikes, and we learn from those strikes. We learn from the grievances. We mobilize, and the fundamental point of mobilizing for socialists is bringing people involved. And I also want to just say to David, I've been there too. I'm a staunch unionist. I've been in bad locals, and I've fought executives for a long time. And I have to say thank you to, I'm in a local now where I'm on the executive, and thank you to my sisters, Connie and Charmaine, who are with us, and Helen, who's coming on to our executive. We have wonderful people who say the fight doesn't stop here at the end of the grievance. It doesn't stop at the end of this issue or bargaining. It continues constantly. And I think that's the kind of local and unions that we need. And that will restore faith in unions if we have people who lead that fight. And I think that's true about Bessemer too. There will be Bessemer's 2.0 in many places where Amazon workers and other workers who lose those representation votes are. And it's saddening in the moment to see a company. I'm angry at Amazon and to see them use the power that they have, but we have to know their power, and we have to find our own power in different ways and alternative ways of organizing, whether through the pandemic, whether in organizing drives, wherever it may be. We have to find ways of organizing ourselves, whether it be on the streets and in the workplaces. Thank you, comrades.
Thank you very much, Connie, Sandi, Peter, and everyone for contributing to